My name is Vavpotič and I'm coming from Marand. I'm actually the product manager of the new product that's currently being developed inside Marand, and we named it the Pathfinder. The presentation today will not really be focused on the product itself, but more on a use case that, the first use case that we are covering with the Pathfinder. And that is the coordinated care of heart transplant patients. For us, this is a very important use case because A, it's a reference use case for the development needs, but also because it fits into our vision that we want to have an actual implementation of a national care coordination framework connected with the cross-national registry, that of Eurotransplant, what just Wouter was explaining, and they're both built on top of the openEHR. As I said, the focus is not so much on the product, but nevertheless, I would like to just to give you a little bit of insight what we're doing, what are the main characteristics, and the purpose of the whole product. So Pathfinder is Marand's own end-to-end solution or framework, which would cover relatively simple needs of clinical registries to a more comprehensive care coordination requirements, so basically connecting more care teams across chronic care patients. The focus is really on clinical data, so there's no administrative data covered, and all the data is strictly stored in openEHR. And we really take, what also Wouter was saying, really take openEHR in a really broad sense. So it's not just something where we store data, but with the vast clinical knowledge that is embedded in openEHR, it really speeds up and enriches the whole development process from the analytical part already. The product itself, it's also really utilizing all the ThinkEHR platform capabilities and all the accompanying rules. So this means either being the form rendering, views, terminology adapter, all this stuff. So from the start on, it's really trying to use everything that the ThinkEHR platform is offering. What's also new is that we introduced a separate process layer. So basically, the application itself is really, process-driven. So the users are having actionable alerts and tasks. At this point, we're using the BPMN and CMN and DMN notation. But the solution is built in a way that when the functionality becomes available within the openEHR, it should be easily replaceable with a new functionality. The product itself is modular, which means that take what you want, keep the rest. And the models don't necessarily need to come from Marand. They could come from any third-party provider. It's also very dynamic in terms of how it's built. Let's dive into the use case. So approximately a couple of months ago, Marand partnered together with Advanced Heart Failure and Transplantation Center, which is basically the whole group of specialists in Slovenia taking care of all pre- and post-heart transplant patients. They're already taking care of the patients when they are considered to be put on the waiting list, all the way through all the follow-ups, procedures, diagnostics required, both pre and post heart transplant. Moreover, they're also in charge of coordination and communication with Eurotransplant, so directly with the Eurotransplant, and they're also the masterminds of the whole research in the area of the heart transplantation in Slovenia and in a broader area. So what's the application range? The first goal was actually to sort of optimize the care plan setting and execution. So really, which patients, male, female, old patients after a certain age, should do what, by whom. So that was the first goal. The second thing was to extend the care team to patients' home. So prior the Pathfinder, there was no really any serious coordination and communication with the patient outside the hospital walls. But now within the Pathfinder, we are adding new functionalities like multi-channel communication, remote patient vital signs monitoring, self-assessment through questionnaires, in order to really arrange and have a full coverage within the hospital and in the home. And the third thing, of course, is to simplify the exchange with Eurotransplant, because now really the clinicians and the care team is actually entering the same set of data in different applications, and we really want to minimize the burden to minimum in order to speed up their work. Due to the time constraints, I will focus only on one part of the functionality, and that's remote monitoring of patient vital signs. On the care team side, care team has Pathfinder's iOS and web application, while in the Slovenian use case, Marand don't really cover the patient side, but patient side is covered by another third-party provider, Slovenian-based company Vavpotič, and they're using there. I'm just sorry, I will use the chair because there are a couple of demos, so it's going to be easy for me to present. So what does really happen in the case of remote monitoring? So when a physician decides to include the patient into the remote monitoring, Again, the demo starts again. So the clinician logs into his care team portal, where he has a dynamic dashboard where he can see all the views and actions that he can perform, and also his task list. And he simply selects John Smith in order to open his dashboard. Here he can see everything that can be done with John Smith, including the action of including him in the remote patient monitoring. In the case in Slovenia, remote patient monitoring requires that the patient gives a consent and the anamnesis is collected if the data is not available before in the system. The second step is to actually set the vitals. So what are the activities that the patient needs to perform at home? This is done automatically by the physician itself. So basically he said this patient should do the blood pressure, weight, temperature, oxygen saturation, and ECG. But what he also does here is that he sets the frequency intervals, set the alerts, so the threshold per value, and basically orders the vital signs. Vital signs are the activities that the patient needs to perform. On the other hand, the patient has a tablet. So in this particular use case in Slovenia, within the activities, he can see everything that the physician has ordered, what he needs to perform on a daily basis. He can see also the measurement logs, the educational content, and he can also start a video conference call with the care team. So just to see particularly what it means to perform the activity, let's dive into that one. So here, these are the 7 activities that he needs to perform during today. It's very simple, the name of the activity, when he needs to perform it, and to have a clear picture on how it does it. For example, to measure blood pressure, he will get the instructions. We'll measure the vitals. And when he confirms the measurement itself, this will go to openEHR platform, and it's going to be seen by the physician as well. And here the interface usually shows that the activity was performed successfully, so he can move out with the other stuff. Within the measurement logs, he can also see what were his what were the values both in table and chart view. So this all works fine, and as long as something doesn't go in a wrong direction. So once when any of the values are out of the threshold set by the physician before, what happens is that the care team actually receives an alert and a task on both the iOS and the website. Oops, sorry. In Slovenian case, the process is done in the way, or the protocol requires that the first alerts are done by the nurse. So when she gets the task, she solves the task, and usually the task itself brings enough information to do it. But in the case that she needs more information on the clinical side, she can also check view patient's record, where all the most important clinical information are presented within the summary. This is, for example, one of the views of the vital signs. Just to conclude, what are our plans in the future? So for this particular use case that I mentioned of the heart transplant patients, we're currently in development. We are continuously testing new functionalities with the physicians. We also start a laboratory testing with the patients. And at the beginning of the year, we're starting with a clinical study of 20 patients, actually led by the care team in Slovenia. And the goal is actually to onboard all the pre- and post-transplant patients in Slovenia as soon as possible to start using the application. In terms of the product, so slowly we are adding new modules. So basically, we're designing and developing specific modules, for example, the protocol builder. The product itself is also the testing and the development environment for all the new functionalities that are coming out with the openEHR platform. And the third thing is that we really want to onboard and teach new partners and development teams to be able to actually implement the product itself. So this is all from my side. If you have any questions, please do ask now or find me later in the hall. Thank you.
Thanks very much, Tina. We have time for one question, I think. Any questions on what you've seen? Rupert.
Thank you.
This is wonderful stuff in a tiny, small area. But as Christian Barnard said, if he hadn't done heart transplants, he might have did public health instead. He'd have saved 40,000 lives instead of 400. What's the actual cost been so far in an industry that totally depends upon planned obsolescence? And how are you managing with have you got a better internet service than we have here?
I can answer that, yes. At least the last question.
Yes. Simple question.
Okay, we can move on now. John, if you think you're next on. I'm going to introduce John Reid, who, again,